Good evening, everybody. It's an honor to meeting youngsters, so many of you, and I feel very proud to say that. And after my coronary bypass, today I had a checkup and they given a green signal. I can start playing tennis from tomorrow. Anyway, with this news, and for the past 5 years, every month we have a topic of interest, environment related. We discuss. We call one of the authorities anywhere in the world, and he will give a talk, highlight us so that we can pass it, take it forward to educate the society in our family. So in this context, to welcome the chief guest officially in the absence of Dr. Satish, we have J. Srinivasan. You all know he's the founder of that one. He is walking dictionary for the atmospheric science and all this thing. You all know about it. And a few things you have to know about it. Number one, he's a man with values. What he speaks, he practices. From his house, he walks from Malleshwaram. From Indian citizen, he used the bike. So we all know that WHO recommended we have to reduce 2 tons of carbon footprint everyone per year. He practices that, what he preaches. This is something great. And is a man with values and always intrigued to find out an answer for a solution. And he always helps academic field. I'm proud to have him here, he being the founder. In addition to that, many of you don't know about it. His uncle, none other, Nobel laureate Sir C.V. Raman. Yes, he won't tell that one. So, yes. So now with few things of this, I have a great pleasure welcoming Srinivasan to introduce the topic and the chief guest.
So Dr. Paramir has been organizing this monthly thing for a long time. With a short break last 2 months because he was indisposed, and it shows his courage and commitment that he has resumed it very quickly in spite of having a bypass surgery. So that's just his drive, and I think he's a role model for everyone to work as long as you want. Okay? And we have covered many topics in this program, and the topic today is a new one. And I think it's the right occasion because we have a lot of young audience here, because the awareness about autism is not very high in India. And I think it's a good occasion for Dr. Sindhu Arul to tell you all about it, so that if any of your friends or relatives have children who have this, you can recognize it and make sure they see a good doctor. So I'm very happy, and I want Dr. Paramir to introduce Dr. Arul.
So the next agenda is the introduction of the subject and also the speaker. So autism spectrum disorder is a developmental disability that can cause significant social, communication, and behavioral problems. It is a type of neurodiversity present as not responding to their names, avoid eye contact, And don't smile when you smile at them. Have repetitive movements as flapping hands, fingers, and rocking the body. Environment, genetic, and epigenetic features play a role in bringing out this disease. Diagnosis involves with many medical professionals has to be involved, not a single person. And it has to be recognized much early so that it can cure some of them if you within a 6-month period. The frequency is 1 in 100 children according to WHO. However, prevalence varies according to across the studies. And also after COVID, it has steadily increased. And WHO action plan for mental health from 2013-2030 included autism in epilepsy and other neurological disorders. Having brief introduction of the subject, to talk this important subject, environment-related issues, we have none other than Sudhindra Arur, Dr. Sudhindra Arur. He did his MBBS, Master of Degree, MD in Pediatrics in Mangalore, DM in Neurology in MS Rama Institute of Neurosciences in Bangalore. He is a consultant pediatric neurologist at Parijma Medical Center and Parijma Institute of Neurosciences in Bangalore. He started with his father, neurologist. Together they're running these institutes. He is a member of Child Neurology Chapter of Indian Academy of Pediatrics, Karnataka Chapter, and Bangalore Neurological Society. His interest is epilepsy, autism, neurorehabilitation. He is the co-author and editor of Epilepsy, Pearls and Pitfalls for the practicing pediatrician. He is a faculty in various conferences and workshops at state and national level. It is a great pleasure extending invitations for him so that we can hear how we can able to recognize much earlier, cure most of the children, and also how to bring the people who came later on, how best we can adjust to this society. Over to you, sir. Thank you.
So good evening. So first of all, I think I thank Dr. Paramesh sir and Srinivasan sir for this opportunity, because for the last 10 years, so once I passed out of the neurology our course, so we started off with at Parijma Medical Center, and I don't know, most of you probably will know neurology is all related to brain. So we epilepsy is our bread and butter, and that's the thing that I was really very interested in, and that's where I went in, and that's what we started doing. But a chance encounter at one of our rehabilitations and at our rehabilitation wing in Parijma, where I was there for a day because of a little other issue, and I just saw the amount of work that these therapists were putting in and the number of children who are coming in with various problems. That's when my kind of entire attention diverted towards neuro rehab, and eventually it went into autism, because I'm not sure how many of you know about autism. This is something that's very close to my heart, because it's something that is potentially completely reversible, absolutely reversible, if identified at a very early stage. Now here amongst you, how many of you have heard or know of autism? Excellent, very nice. So very good. So that means makes my job a little easier. But again, like I would say, it's probably one of the few, what can I say, talks where the orator is probably as clueless about autism as all of you are, because there's so much to learn about autism. There's just barely scratching the surface. And one of the things that I was keen on with the Indian Institute of Sciences is that to look for any kind of collaboration or some kind of an activity where we can do something better for children with autism. So in short, what is autism? I'll come to the definition. So the definition is group of neurodevelopmental disorders with varying levels of severity and impairment in social communication and interaction, and restricted repetitive behaviors, interests, and activities. It's just a terminology. So I'll just give you in short what happens in autism. So just picture a child who is probably around 1 year of age, 1 year, 2 months of age. It could be just picture maybe your nephew, your anyone. So a child who is 1 year, 2 months of age and who is completely bubbly, jumping around, laughing. The moment you come inside the door, comes running towards you, mama, mommy, whatever, screams and talks maybe a little jargon, 3-4 words, all happiness, and showing enough amount of eye contact, love, and immense satisfaction at seeing you or the parents. And just fast forward another 6 months down the line, just a short 6 months down the line, the same child who's running around, jumping around, recognizing you, loving you, and talking to you is absolutely doing nothing of these things. Child is still running around, still playing around, but absolutely no eye contact, absolutely no recognition of parents, no recognition of uncle, auntie, whatever, not recognizing you at all, in his own world, in his or her own world, continuously rotating around in one place or jumping around, not responding to any of your comments, not talking anything. Now, that is what we're dealing with in autism. This is a disease where it just creeps upon you suddenly and very insidiously, slowly, and before you realize it, the entire joy is taken out of the child. The child becomes a shell of what he or she was. The good part about autism is that, if there is a good part, the good part is that you identify it early. If you are sensitized enough and the pediatrician is sensitized enough and you identify it early, you can absolutely reverse the symptoms. You identify it within the first 1 or 2 months, 3 months of symptom onset, then you can absolutely reverse the symptoms. It takes time. It takes a good 1 year and a lot of effort from the parents, but you can absolutely reverse this. That you missed that 6-month period, that 8-month period where a lot of our parents go, I call it parents, our parents are patients. The parents go into denial when we tell them this, and they come back after 8 or 9 months later, and the child is completely even more worse. The worst part is you miss that 6-month golden period. The child is completely lost. You have absolutely lost the child. So that is why this is a make or break disease, and that is why I'm very passionate about this, because you can absolutely reverse the symptoms, but you need to have a little sensitization. Where we have problems, I'll come to that later. So in short, what autism is, there are 5 main things. Just forget about this statement, this thing. So there are 5 main problems in autism. One is the child is physically active, overactive, but there are 5 problems. One, poor eye contact. There's hardly any eye contact. The child is in his own world. Even if you talk, there is no eye contact. There's no response. The child is constantly running around without any specific purpose. And language, which was very good, 10 words, 4 words, 8 words, becomes absolutely zero, not even babbling also. And there is absolutely no interaction with anyone. The child doesn't even recognize the parents. And this was just in a matter of 3 months, 6 months or so. So 5 problems: poor eye contact, poor response, poor socialization, poor sitting tolerance, and complete speech regression. So that is autism for you. So autism, we call it autism spectrum disorders, because autism, which I'm talking about right now, that covers 97% of all children with neuroregression. That is these symptoms come under autism per se. 3% of children come under these this set of these other conditions called Asperger's, childhood disintegrative disorder, Rett's disorder, and PDD, pervasive developmental disorder. These are just names. You don't have to really go much into depth. Just remember the term autism. So yeah, this is what I was talking about. These are the cardinal features. You have a lot of other features, but these are the cardinal features: poor eye contact, response, sitting tolerance, socialization, speech regression. So usually what happens is the conundrum for us is when we see the child coming into the OPD, you're sitting in the chamber and you see the child walking across and coming inside. It just takes, for us, it takes about 10 seconds to identify whether the child has autism or some other condition. It just takes 10 seconds, because in those 10 seconds, you can see all these symptoms. You can see, absolutely, you can see, you can make out. But the problem is convincing the parents, because what happens is you tell the parents that the child has autism. They have obviously read about it in the internet. Everyone now comes with sheets saying this, and so they already know about autism, but they go into flat denial. The moment I tell the parents itself, I slowly build it up. As I'm telling them, I can see their faces completely setting into stone, and they just absolutely deny that. That is where the problem is. You can make out, but they also can make out, but they can't. They don't. So that is where our problem is. So we'll talk about that. That is also a thing which we have to mitigate. Environmental factors is one. Now, these are the other things which come in autism spectrum disorder. A lot of other features are there, more to do with neuropsychiatric symptoms. Hyperactivity is there, obsessive oppositional defiance disorder is there, attention deficit is there. As they grow older, depression is there. Some of them are extremely gifted. Some of them have OCD, severe OCDs. Some of them have, almost all of them have anxiety, and all of them have ADHD. So there's a whole host. That's what sir was telling. One person can't manage this. You can give them guidance, but you need a whole team to take care of the child effectively. But again, the reward at the end of the day is amazing. So why are we talking about this condition? Because as you can see here, autism is a disease which was almost unheard of just even about 15 years back. None of us were sensitized to it. Starting from around 1 in 10,000, long time back, about 1 in 1,000, 1 in 500, and then suddenly you see it shoots up to about 1 in 54 in a matter of just 8 to 9 years. And now the recent, this is the 2016 data. 2023 data by CDC shows 1 in 36 children in the US. US has the highest burden, to be very frank. India is not very far behind. It's 1 in 88. 1 in 88 children have autism, and the number is just increasing by leaps and bounds. Even we are also guilty. When I used to do my MD pediatrics and I was a PG student, our job was what at that time to just try to see as many patients and leave. Only later the good sense came to our brain that you have to learn on the job. So what we used to do is whenever any parents come and tell us that the child is hyperactive, not talking much, not looking much, we would say, idu pick up agatte ನೀವು ಸ್ವಲ್ಪ ಬಿಡಿ ಒಂದು 6 months you wait and then the child will improve. We have also brushed it off. And a lot of pediatricians do this, but we see now there's a sea change. A lot of pediatricians are sensitized and they refer the patients to us very fast. That makes all the difference in the world. This is the reason why this is a real big talking point, this disorder. And post-COVID, it's just shot up like anything. I'll come to that later. So it's the leading cause of disability among all mental disorders in the under 5 age group in USA. And this I already told you, 1 in 36. And in India, it's gone up to 1 in 88. So it's as you can see, it's just shooting up like anything. So, so we've talked about autism now, these 5 cardinal points. So you see any child, I think you will also be able to figure it out. I'll just show you some videos later. So now what is the etiology? We're talking about autism. It is rapidly going up. So I'm sure you'll be asking, why is it going so high, sir? And to be very frank, I don't know. Like I said, there are a lot of things about autism which we don't know about, but there are few things which are associated with autism. One is genetics. A lot of children have small random mutations. By genetics, I don't mean family related. Family is about 20%. 80% of the time it is spontaneous, what we call de novo mutations. De novo mutations means a spontaneous mutation which has occurred randomly. There are certain things for that, but it's mainly random. So these random mutations, there are more than 350, 360 genetic mutations for autism. This, along with the environmental factor plays a very, very, very big role. This, along with environmental factors in the age group between 10 months to 30 months, can tip the child from completely neurotypical to autism. So if genetics alone is there, sometimes it may not lead to autism. If environmental factors alone is there, sometimes may not lead to autism. If these two come together at that age group, if it is before 10 months, no problem. If it is after 30 months, no problem. The child is past the age group, but between 10 to 30 months, it's a problem. So like I said, post-COVID, we have seen a lot of children with autistic features. Most of the time, the child is inside the house, cooped up, not much of social interaction. Both the parents are working, nuclear families. Both the parents are completely on the job. The child is left with a gadget or a screen time, or the child is left with a nanny. The nanny is also on the phone. The child is also on the phone. So at the end of the day, you find that the child is completely immersed in the social media or whatever, the social, not really interacting with anyone. 3 months, 4 months of this in this age group between 10 months to 30 months is enough for the child to go into autistic features. So not everyone, but those who have either this or this. So environmental factors, genetics, we know there is a lot of causal association. Problem with environmental factors is what we have seen, we can tell for sure, but there are a lot of other conditions here, air pollutants, heavy metals, and industrial chemicals, and there are other things like paternal age and other things. So some of them are absolute indicators. The rest of them are plus minus. The reason is we don't have enough amount of data, that we don't have enough amount of material to tell for sure one way or the other whether it is going to cause autism. Strong evidence, the only thing that we have is parental age and preterm birth. These are strong indicators for autism at a later date, especially parental age for males above the age of 35, 40 especially, and for ladies more than 35 years of age, strong association for the child to later develop autism. Why, you may ask? It is because of the same de novo mutations. The older you are when you are, it's not a hard and fast rule, but I'm just telling, the older you are when you have a child, the more the chances for the child to have small point mutations. That is where you end up with this. Preterm birth is also associated with that because of the associated complications. And of course, HIA, that is hypoxic ischemic encephalopathy. When the child does not cry immediately after delivery, the child can later develop secondary autistic features because of damage to the brain. So these are the strong evidence. So all these, like I said, even we are not very sure. So some of the papers show a positive bias, some show a negative bias, but it's better to know about these things. As time goes by, with more and more collaborations and studies, we'll be able to come up with, we'll either be, we'll be able to negate it, or we'll be able to tell positive. And these are mixed responses. So I'll be going through each of them in a limited way, because our knowledge also is limited. So now the thing is, as you can see here, there have been lots and lots of studies on autism. There have been more than 65,000 papers on autism across the United States over a period of I think this is from 2003 to 13, I think, and there's one more set next slide up to 18. So in spite of this much of research, we still don't have a clear-cut issue, because it's a very diverse field, autism. The causes are very, very diverse. So eventually, I've taken about 234 studies out of this. And from that, we come up with these environmental factors for risk for autism. Chemical factors, which include specific heavy metals mainly, and it also includes certain drugs. Physiological, that comes to the maternal age, paternal age, and the birth spacing and things like that. I'll talk about that. Nutritional, various vitamins and other things which can or may not cause. Social factors. This, in my opinion, is going to be the biggest game changer, both in terms of causing autism and preventing autism also. So we'll talk of that also. So now if we just broaden this, chemical factors, like I said, environmental chemicals, common thing is lead and mercury. The child is completely exposed to these things in a good way, in a rather bad way. And vaccines, and we'll touch a little bit about vaccines. That is for pediatricians, one of the hotly contested topics. Then these are the other things where we talk about the paternal and maternal characteristics. We talk about the nutritional factors. We talk about the social factors. So coming to the chemical related bracket, you have heavy metals, mainly mercury and lead, and you have air pollution. I think everyone's now getting more and more stuck with air pollution. Every time you read the newspaper, it's always about air pollution in Bangalore, air pollution in Delhi, stubble forming here, there, whatever. So this also plays a big role, and I'll talk about each of them in a small detail. Now we have mercury. Now the thing why I'm talking about mercury and lead is because this is present to a great extent in especially food stuff like fish. So we see this on a regular basis. Children, when we do the testing for children with autism, this is one of the factors which always comes out in red. It's a little on the higher side. Now, in spite of all this, we are not very sure how much of a role this plays, but almost you can say 3 out of 10 children with autism have high levels of mercury in their blood. This is one of the things. Now, various studies are there. Some of the studies have shown a positive bias. That is basically one of the factors is mercury will go and convert into diethyl mercury or monoethyl mercury, and this will act on the, supposedly it acts on the DNA, causing a little bit of tear in the DNA or a demethylation of the DNA. Again, this is theory. We don't really have clear-cut evidence, but over a period of time, we may know. So some of the studies have shown a positive bias, that is increased mercury can cause autism. The rest of it is mixed. So that is one of the things. Now coming to lead, exposure is there everywhere in your toys, the plastics, everywhere. Lead exposure is there. Here, unfortunately, we don't find much of children when we do the lead levels. We don't find a very high level, but most studies also are very mixed in this regard. Now coming to, most of these things, take it with a pinch of salt, because even I'm not very sure, but certain things are definitely positive. I'll come to that. Coming to vaccinations, because this is one of the things which all my parents keep asking, that is the patients, please, I keep telling parents, my children, my parents. So all our parents, when they keep coming, the one question that they ask is, should we give vaccine? Should we give vaccine? And invariably, some of them come with papers and say, sir, no, look at this, we can't give vaccine. And I always say, please give vaccine. Absolutely, there's no causal indication that vaccine can cause this. The biggest thing is MMR vaccine. So there was a study which came out about on the 25 years back, a Wakefield study, Anta, wherein the lead author absolutely discredited the MMR vaccine and said this is one of the causes for autism, Anta. So that is, and that the discussion went on for 2 to 3 years. Eventually, it was found out that most of the data was fudged, and the lead author was in the pay of a trial, criminal mass lawyer. Who in the US it is like that. You have a mass lawyer and you have a tort system where they, take some class action against a whole bunch of corporations or doctors or other things, and they try to extract money. So he was under the pay of the trial lawyer, and the entire data was fudged, so he got disbarred. So for a good 3-year period, a lot of children in the US and Europe got missed out on the MMR vaccine. This I'm talking about 15, 18 years back. And because of that, at that point of time, we saw a massive outbreak of measles across the east coast of US as well as European countries because of the lack of vaccinations. And this is in states where previously measles was zero because of the vaccination. So I always tell the parents, please, there's no causal association with vaccinations. Please go ahead. That is one of the things which invariably they ask. So debunking this, environmental factors, yes, some of the vaccines may be, but not the MMR vaccine. This was the study that I was talking about. So now coming to medications, there are certain medications which are thought to cause autism factors, but again, this also is not really a thing. Valproate is one of the drugs. This valproate that I've written over here. SSRIs are basically depression medications, and valproate is basically one of the best drugs for epilepsy. So certain case reports came up saying that they may cause autism, but several other case studies have come over a period of time which have debunked that. So that is not there. So most of my parents also have the same query that, no, you're giving valproate, how can you give? So these are all the things that we have to, tell the parents and educate them about. So now coming to these other factors, that is the parental factors. So you have the parental age. Among all these things, you have a whole host of factors here. The only ones which are absolute causal indicators for causing autism is parental age. For gents, it is more than 40 or above 40. And for ladies, it is above 35, where they have a very high percentage. From 35 onwards, the percentage keeps increasing. Less than 30, the percentage of it is just about 0.03%. Beyond 30, it goes up to 0.4, 0.5%. And more than 35, it goes up to about 1%. Beyond 40, it goes to as high as 7 to 7.5%. So it's a big number. So a lot of studies have shown this. More than 5 large-scale studies have shown a positive bias towards parental, especially paternal age, more than maternal age. Why, we don't know. So then the second thing is assisted conception, IVF. Nowadays, that is also on the rise. Most of the people are into careers and everything, and they're kind of postponing and things like that. And other factors of stress and other things. So a lot of there have been 3 large case studies which have taken more than 3,000 children with autism, where they found almost 16% of them are coming from the assisted conception category. So there is a definite causal association. One of the reasons for that is probably most of the time with the assisted conception, they are born preterm. Again, preterm is one of the causes for autism, and when they're born preterm, they end up having other problems. There's a high possibility of what we call the central areas of the brain getting damaged in a minor way. Child picks up, but later develops secondary autistic features. So that is one of the, so these 2 things are, and of course, excessive diabetes, gestational diabetes, not just gestational diabetes, and then which carries on. So these are the 3 things which have a high causal association with autism later for the child. And from the child point of view itself, you have low birth weight, low gestational age, and small for gestational age. So all these are, how are they causing autism? That is mainly secondary autism, not primary autism. The child is born preterm, or the child is born low birth weight. They have complications post-delivery. They are in the ICU for a longer period of time. Because of that, there is some amount of damage to the brain. Child improves, but later starts developing autistic features because the brain is not fully coping up as the child develops. So rest of the things, when we look at all these things, these are all other factors. Some of them talk about multiple births, birth spacing, seasonal variations, a lot of case studies. I don't want to go on putting the case studies, but a lot of them are not really causal associations for autism. So among various things, then there are other conditions like brain-related disorders. Again, these don't cause any kind of autism, because all our parents have these queries that the child had this kind of infection. Now the child has autism. Is there a factor? Doesn't work like that. It's only these factors which are predominantly responsible for autism at a later age. So this I've already spoken to you about, assisted conception. These are also maternal chronic diseases like diabetes. Some of them are causal associations. Low birth weight and gestational age, again, like I said, because good number of studies have shown because of the complications after delivery, they end up developing autistic features. These are not there. Now, the few other things. I don't know whether people know, a lot of people have doubts with environmental factors like folic acid, vitamin D deficiency. Invariably, most of our patients come with blood reports with vitamin D. I don't know how many of you have taken a vitamin D test. Have any of you taken vitamin D levels in the past? How much was it? Lower than that. Yeah, the cutoff is 30. But when you do for about 100 people, you will find that almost 85% of the people have low vitamin D levels. So this is one of the other common things that they ask. But in this case, what happens is we have seen a lot of children with autism, and we don't normally do vitamin D levels, but we supplement the children with certain nutraceuticals. We give omega-3 fatty acids, we give vitamin D, we give vitamin B12, we give vitamin B6. So there have been studies which have shown that there is a definite push towards for the child who has these supplementations at an early stage. They have a tendency to improve a little faster. We have an ongoing study in Parijma also where we are doing this, where we have more than 600 children. So that we will let you know shortly. But there have been numerous studies which have shown vitamin D, vitamin B6, vitamin B12, and omega-3 fatty acids benefit children with early stage of autism. Once they're full-blown autism, it's difficult. So that is some food for thought. So apart from this, social factors, I'll just talk about the social factors a little later. But in the entire environmental factors, what we do know is it's only the maternal age, paternal age, and it is social factors is a separate topic by itself. I'll come to that. These are some of the things. Chronic conditions like diabetes, which can later trigger the child with preterm deliveries, low birth weight deliveries are the other ones, and nutritional factors like vitamin D, which do not cause autism, but which may help in children with autism to improve faster. So social factors, I'll come a little later. So right over here, I'll talk about this. So what are we seeing over here? Oops. So what are you seeing here? Pardon? Elephants? Yeah, so we have an elephant in the room over there, and we have all the bunch of people over there not really bothered about that. So what is the elephant in the room? Proverbial elephant in the room that we are missing. Okay, I'll answer that because it was a kind of a surprise for us also. So everyone have been affected to some extent or the other by COVID, right? Everyone has had some issues or the other. So what has happened is pre-COVID and post-COVID. So pre-COVID, we used to see maybe in a day, one or maybe about two children with autism on a regular basis. I'm talking about coming fresh, not the follow-up patients. Fresh patients, maybe one or two we used to see. Post-COVID, we saw an absolute exodus of patients coming, which would go on up to about 10, 12, even sometimes 15 children on a daily basis. Every day we used to see new patients, new autistic children with this kind of number. This went on for almost a period of close to 1.5 years. That was something that was not just surprising, it was downright scary because you're seeing, and every patient who's walking in is autistic. So you see one autistic, you see 4 epilepsies, you see headaches and everything, one more autistic. Here you're seeing everyone autistic. So then a new term came up called virtual autism. So we started the one characteristic, why I'm talking about social factors, Antandre, this is something that is you can at your level, at your family level, you can make some changes and prevent children from falling into autism. Believe me, this is an epidemic which is only going to get worse. So social factors. So what happened during COVID? Most of us were inside the house. All of us were cooped up inside the house. Children were not allowed to go outside. Everyone inside the house, everyone working from home. And nowadays, most of it is like that, isn't it? Most of them have nuclear families. Everybody have migrated elsewhere. And it's only the father, the mother, and the child, or children. So the parents are working on the computer and the child is working on the mobile phone. The nanny is also on the mobile phone, and everyone is inside the house, not really no interaction at all. For several months, they were all inside the house. So what happens is in such a situation, this is what we talk about environmental factors. So not every child who has had this will end up with autistic features. This is where the genes plus the environmental factors play a role. We have seen innumerable number of children coming up with autistic features. The only good thing about this virtual autism or autistic features is, unlike primary autism, where there is a proper genetic basis and it comes even with a good environment, here, because of the genes or the environment, you had autistic features. You had all the features: poor eye contact, poor response, poor socialization, poor sitting tolerance, language regression, all features of autism. But the children You identify within the first 3 to 6 months, you start therapy, you start medications. My goodness, you see in about 3 to 4 months, the child improving very well. Child who has regressed in 6 months, in the next 6 to 9 months has come back from zero to hero, hero to zero to hero. It is really amazing what you used to see. That is the first time where we actually felt that pediatric neurology is really rewarding, because pediatric neurology per se is very depressing field. It's like oncology, because most of the time you're dealing with children with brain damage, with a lot of damaged things or genetic issues which don't improve at all. At best, you can make them walk, you can make them talk a little bit, but most of them are handicapped. So it's a problem. But here, for the first time, we realized that we are making such a difference. You're just getting the child back on track. And you had all these videos where the child, the parents would come and show the child is talking, running, everything. Now completely in front of you, is completely not doing anything. 6 months later, the child is back to that old level. Oh, that was really amazing. It still is happening. So for the first time, we're feeling, okay, great, we're doing something, Anta, because previously we used to only keep running behind the disease, and the disease would always go ahead of us. Here, for the first time, we're doing something different. So what I'm trying to say is social factors is the biggest elephant in the room. And I've shown you 60,000 research papers and things like that I've shown you. None of them talk about social factors. It's something that has come only post-COVID. Next 3-4 years, a lot of papers will come which will show this. We also have a couple of papers going on in Parijma right now. But this is a real thing. Virtual autism. So virtual autism, something that so excessive screen and gadget time. And as you can see nowadays, most of the time it's like this only. The child is crying, the phone goes into the hand of the child. The child wants something and the parents can't give it, the mobile goes over there. They give it to the nanny to play with the child, and the nanny is also on the mobile phone. Both of them are there. So excessive screen and gadget time, we have seen this makes a lot of difference. The child completely regresses. Parental and familial understimulation. This happens when most of them are busy working and they're not giving that much of time to the child, even with the best of intentions, doesn't happen. So this is also a real problem, understimulation. Decreased social interactions. Everybody's in a nuclear family. Everybody has their own kind of space, and there's not much of social interaction everywhere. So these are also one of the things. And of course, genetics. So if you can correct this, you will find that almost our patient load from 10-15 new autism patients will go back to 1 or 2. So this is something that I would want everyone to kind of focus on, because this is where in our fast-paced life, we are just completely neglecting this. So most of these children improve very well. Unlike primary autism, they improve completely, absolutely. They can have rapid and complete improvement. Thing is, early identification, appropriate multidisciplinary neurorehabilitation is the key. Vitamin supplementation here works a little better. So that also we have to have more studies for that. But these two things are definitely gold standard. So these are some of the research projects that we are going on. As you can see, we have a lot of patients with autism there. So we have a number. So most studies have taken only 250, 300 children in each project, some of them 10, 20. So we kept a cap at 400, and we had to take a few more children after that. So, so all features of virtual autism is ongoing. And I can tell you that out of this 417, it's a process which went on for about a year that time. So out of this 417, in a span of next about 1 year, we have seen that almost about 112, 113 children have completely improved, absolutely completely improved. The rest of them are in various stages of improvement. So, but, and there have been some dropouts, the number of them have dropped out. But this is, we will be coming up with this. So this social factors is really going to make a difference. So, I'm not sure if I have a little time. I think I'm almost done with time. If I have about 3 minutes, I just want to show a video what we do with the children with autism, because see, the thing with autism is we pediatric neurologists are just traffic policemen. We see the child, we diagnose, and we say, okay, you go direct, you go that side, you go here, you go to the physiotherapist, you go to the speech therapist, you go to the occupational therapist, and we give vitamins. And every 2 months, we see therapist works the magic, child comes back, child has improved well, and we get the blessings. And okay, I'll take that. So, but what do we do with children with autism? So how do you improve them? The child who's now completely gone back into a shell, how do you improve? We do something called as infant stimulation. That is, as the name suggests, we stimulate the infant. We stimulate the infant through various developmental toys and try to get the child, try to stimulate the senses of the child, auditory stimulus, visual stimulus, tactile stimulus, so that the child gets back to looking at things and doing things. Second thing, as the child starts improving with infant stimulation, so the child is completely in his own shell, and then with infant stimulation starts becoming aware of the surroundings, starts looking at people, starts smiling a little bit. So once this is achieved, we go to the next level, which is called occupational therapy, where day-to-day activities of the child is taught, like the child going towards the bathroom and doing the potty. I mean, it's not like we do the training there, but we improve the brain so that child is able to do the day-to-day activities. So occupational therapy is the next level where we do more complex tasks. At this stage, we put the child into speech therapy because the speech is completely gone. We can't do speech therapy right at the beginning because you need at least 30% brain development before we can do speech. So with this, you get 30-50% brain development. Then we go to speech therapy. Lastly, we go to remedial therapy where the child is ready for, we make the child ready for school. So this process takes at least 6 months, may go up to a year. That is in virtual autism. So this way we can get the child a little better. So I just, if you don't mind, so I know it's a virtual reality thing where though we talk about virtual autism, but we also realize that virtual reality in certain children really works wonders. We are one of the few centers to have that. So with all these things done, so I will just go back to this. So the mitigation of risk factors, it's just this much. Advanced parental age. The only ones which are clear cut is advanced parental age, and we need to kind of see if we can sensitize the people to avoid this. And autism in the family, this is very important. 20% of them have a genetic basis. We have what we call as the whole exome sequencing. 5 years back, 8 years back, this was not there. We have this, it's a blood test where you can identify at-risk children even before they are born. So you can completely bypass the genetic disease, or if it is too late, like that other child which showed you, we can get them ready from the very beginning itself. So these are the things which we can do to mitigate the risk factors. And dietary supplementation for at-risk mothers, not for everyone. And the most important is this: virtual autism is completely treatable, and this is what we see on a regular basis. Previously primary autism, now post-COVID, at least 50% of kids are all virtual autism secondary to social factors. So very important for the family to be a little more aware of this. And in the rat race also, you have to look at the child than the race. So adequate stimulation of the developing infant, increased parental and social stimulation, especially during months 10 to 30 of the infant. This is the most important. Before this, the child is fine. After this, nothing will happen to the child. But these 20 months are the most important. That is when the parents and the family as a unit have to focus more on the child, and screen and gadget time to be as less as possible. Early identification, appropriate multidisciplinary neurorehabilitation with a whole team of therapists is the best. At the end of the day, the number of children who need neuro rehab for autism is exponentially increasing, as I've shown you. Early and appropriate therapy under one roof is the key. Most important, increased awareness, interest, collaboration, innovation, because we are still scratching the surface of autism. There's much more. And early, appropriate, ethical, and better multidisciplinary treatment is the way forward. At the end of the day, after all this, this is exactly what we know. This is just the whole thing about autism. This is what we know. This is what we think we know. This is what we have no idea that we know about. So this whole thing, this whole huge pipe is what we need to, as a team, improve upon. And that's only possible with sensitization. People are aware, they will come. If people are not aware, they will not come. Thank you very much.
You heard the wonderful talk. Now there are question session and also photograph after that. All of you, please stay there. Any questions, please? We have 10 minutes.
Yes, sir.
So, wonderful.
What is like the
oldest age when kids are
oldest, is it? The latest, the most, like I said, it's about 30 months. 30 months is the cutoff. Technically speaking, even at 3 years, 4 years, if there's a brain damage, primary autism, which comes by itself without any kind of brain damage, is usually about 2.5 to 3 years. We have seen children even at 3.5 or 4 years also, but 95% of the time it is 3 years, you can say 3.5 years. 3.5 years is the absolute cutoff. Yeah.
Many times we see that autistic children or persons are little bit more intelligent than the common.
Correct. Yes.
And is this common in every autistic patient?
Unfortunately, no. That is actually good for the movies and things like that and inspirational stories, but it is a very small percentage. So I had put on small this thing saying that these children are gifted. That gifted percentage comes only in about 5%. Vast majority, 95%, are unfortunately not in that category. Yes, please.
Where do you think is today's technology intervention needed? What we could do?
More than any technology, I feel it is only the awareness of the primary caregiver, that is the parents, more than the parents, the pediatrician. What happens is in our practice, a lot of time, 5 years back, it was not there. But now, especially in our Hebban branch, there's one pediatrician who's excellent. They come for vaccinations or whatever it is. They don't come with these symptoms. The parents never come with the symptoms because somebody in the family is always telling them, hey, my uncle spoke at 4 years, your grandfather spoke at 5 years, the child is not speaking. The child will speak. And by the time the child is 5 years, the child is not doing anything. So when they come for vaccination at 9 months or 1.5 years, couple of times he has picked it up and he has sent it to me as early as 10 months. Oh, I could have cried at that. My God, 10 months is like gold for us. We can get the child completely ready. So it's always the pediatrician. Nothing beats what you see. Like I said, 10 seconds is enough to see and make out. You don't need any testing for this. Your what you see is that's enough. But your eye can see only what you are aware of. So sensitization is most important. So some of these pediatricians are very good, and parents also, if they know, it's best. So just that awareness and pick up. That is the most important.
Yes, sir.
How many inside about 4 years of age?
So once, see, what happens is up to about what we say is up to about 2 years of age, you have maximum brain development going. Let's say arbitrarily 80% of brain development in the first 2 years, another 10% in the next 1 year, and then another about 5% in the next from 3 to 5 years, and from 5 to 10 years only another 5% of development. So the child is 4 years and that means almost you can say 94% of the brain development, functional brain development is already done. So I have, if you're talking about virtual autism, we have seen children improving completely, but primary autism where there's no specific other environmental factors, I have hardly seen any child who has fully improved. They improve to an extent that they regain this much. They're able to recognize the parents. They're able to smile. They're able to respond. Eye contact becomes fair, and some amount of understanding is there, and 2-3 word sentences are there. That's it. They come to that level. That much is possible. Some of them not even that much, and very rarely they improve fully. Very rarely. I won't say no answer. Very rarely at 4 years.
I have a last question
Yes.
before I concluding remarks.
Yes.
I think we know the world mercury poisoning city. It is in India. Where it is? Kodaikanal. Heard about? It is Kodaikanal, where they used to be the mercury thermometers. All little waste has to throw it in the river and lakes. All the fish has eaten. It has to be done there. So what I'm trying to with this comment, have you noticed is much higher in Kodaikanal area in Tamil Nadu than Bangalore?
We get patients from everywhere, sir, but unfortunately, Kodaikanal, no, sir, I'm not. Maybe that area, the pediatricians will know better, but I have not.
Okay, sir, thanks. Now, he covered so beautifully, simple way. All the you're all aware yourself, and when you go there, see your friend, recognize much earlier, so that it can be treated and cleared completely. We make you feel so happy. Neurologist always has to say they're all very handicapped and all these things. They have to worry about it. Now it is a happy situation. So he also concluded the genetics is a brick and mortar. Environment is an architect. Bring out all the disease, environmental issues. Is covered it up, and I don't think I need to say anything further. And also I want to make a statement. His father is one of the greatest. He's the first one to start pediatric neurology clinic in NIMHANS in India. And we are all contemporaries for that one. We are all contemporaries. and we play. I'm a pulmonologist. He's a neurologist. We used to work together. Lakeside also used to come once a week to our hospital. Now he feels proud to say, "Oh, I am his father, not he's my son." I think greatest occasion.
Still
I think-
much more, sir. Needs to go before.
Yes.
Nice.
Anyway, I think that is what we are all until the last breath is the learning process. Never ends. These things, the way you covered, we thank you very much. We are all thoroughly enjoyed it. It's a great honor for us having you here. And as a token of appreciation, we want to give a small memento, Professor Srinivasan sir. Please hand over.